question, so I'll do the role play myself for this. So then I'm going to have a chat later about the concerns. 2 minutes reading time, Charles. Charles, you're doing for Shama, right? Yeah, I double checked. Yeah, thank you. That's fine. Time started, my dear.
Okay. Hi, I'm Dr. Charles, one of the doctors in the early pregnancy clinic today. May I confirm your name and age, please?
I'm Findola John. I'm 19 years.
Okay, and how would you like me to call you?
John, Mrs. John would be okay.
Okay, Mrs. John. Very nice to meet you. Are you okay?
I'm quite anxious. I'm quite anxious about my pregnancy. I just
Okay,
got pregnant and I didn't realize that I'm pregnant. So I've got lots of things in my head because I'm bleeding. I'm so
okay,
concerned about um I'm so concerned about because I just twisted my foot around 10 days back and I didn't realize that I'm pregnant. So I just had an x-ray because of that
okay.
x-ray.
I'm
Yeah,
sorry to hear that.
yeah.
Would
I
it
realized
be
later that I'm pregnant, so I was so concerned about this and what to do now because I've heard
okay?
that the extra exposures in the pregnancy, so that's
Okay.
gonna harm the baby. Am I right?
Well, my
Yeah.
team and I, we are here to address any concerns that you may have and support you in this pregnancy.
Oh,
Is it okay to go ahead and ask a few questions now?
yes, please.
Okay. So tell me a bit more about this bleeding. From when did it start?
So the bleeding started, I think, 3 days back, and I assume that because I feel that I can associate it with an extra exposure because I feel that it causes abnormalities. So the pregnancy is not normal. So,
Okay.
yeah.
I understand your concerns with respect to the X-ray. Um, but is the bleeding, is it heavy?
It's more of a sporting, but it's bright red. It's not brown.
Okay.
I I don't have to change pads, but yes, panty liner has to be there.
All right. So are you feeling lightheaded at all, or do you feel like your heart is racing now?
So, I feel it's the same. It's been 3 days. Every day I have a sporting.
Okay.
Um, Neither more nor less. I do not have any pain. I do not have any associated complaint with that. But yes, when
Oh,
I wipe from tissue paper, it's all red. So I know that there is something wrong and that is on my head. I
all
would like to
right.
tell you that I'm otherwise a very type A person. I've got anxiety disorder. I'm taking medications for anxiety and depression. I've not stopped it in my pregnancy because I know I've got a very bad panic attacks because of that. So
Okay.
it's not going in my head. I think I'm not able to cope up with with an abnormal baby.
Okay. So thanks for that information, and I'll attempt to address your concerns. So can you tell
Okay.
me a bit more about the X-ray that you had? You said you had a fall?
So the X-ray was around when I was in the pregnancy of like 6 weeks.
Okay.
So it came out to be normal. I didn't take anything. It's just like it was an exposure.
Okay, and it was just the one foot that they did the X-ray out.
Correct.
Okay. Do you remember if any shielding was used on the tummy area?
Oh, they asked me if I'm pregnant, but I confidently said no.
Okay. Well, sometimes this can happen. Um,
Yeah.
so is this your first pregnancy?
Yes.
Okay. And do you have any medical problems of which you are aware outside of your anxiety?
I only see my mental health team. I get medicines for the anxiety, and it gets worsened when I've got stress around. So nowadays,
Okay.
I got, even with the medicines, I've got very bad panic attacks.
Okay. And forgive me for asking, these questions might be a bit intrusive, but it's just to get to know a bit more about you. Are
Okay.
you in a regular, stable relationship?
Oh, I'm happy with my partner. We are married, and parents are quite supportive, and we have been together for the very young age. I do understand, but we are happy to have a baby. I mean, we were not practicing any contraception at all.
Okay. All right. And have you ever been treated for any sexually transmissible infections?
No.
Okay. And well, you have not just confirming had any pap smears done as yet, right?
So no, I didn't have an invitation as of now.
Okay. Um, have you ever had any surgeries on your tummy before?
No, doctor.
Okay. And with respect to the medication that you are taking for the anxiety, do you know what the medication is?
So, it's something known as fluoxetine, if I'm not wrong.
Okay. And
Yeah.
your doctors at the mental health clinic, are they aware of your pregnancy?
No, I didn't tell them at all. I was so anxious. I thought that it's going to end up because I was bleeding. So I thought I don't need to inform them.
Okay. And you are still continuing with this medication?
Yeah.
Okay. Um, and do you have any allergies?
No.
No. Okay. And what do you do for work?
So, I'm not working. I'm at home, but I do have my thesis going on for my final project. So I'm just completing my education.
Okay. And do you know your height to weight ratio?
22.
And do you know your blood group?
A positive.
Okay. And this is just a general question we ask everyone. Do you have any reservations to receiving any blood transfusions?
Now, I'm okay, but do you think that I need transfusion?
Uh, no, it's just a general question, just in case there are any complications later
No,
on, we'll know
I'm
how.
good to go. I'm good to go.
Okay. Um, do you smoke or drink alcohol?
I have been a smoker, but that's been around 6 months that I have been cutting down on that. So I think I'm an occasional smoker now. I'm not habitual.
Okay, so we can offer you some assistance, referral to the clinic to help you
Yeah.
stop it.
Okay.
Okay. And do you use any recreational drugs? I'm sorry for
No,
asking.
no, never. I've never been into drugs.
Okay. And are there any medical problems in the family of which you are aware, like blood clots in the legs or lungs?
So I don't think so. No,
Okay.
that is good.
And I know that you mentioned that you're pretty anxious about everything that's
Yeah,
occurred with respect to the
yeah.
X-ray.
Because doctor, what I know is that a patient who is pregnant should not bleed. Am I right?
Well, this is something that is common. It could happen early in pregnancy, and there are different avenues that it could take. Um, so before we go further, if you would permit me, and thanks for your openness so far, I'd like to perform an examination just to
Hmm.
feel the tummy and just take a look down below to
Okay.
assess the mouth of the womb. Is that okay?
Sure. Please go ahead.
Okay, I'll do this in the presence of a chaperone.
That's good. That's okay.
Okay, so based on what you have just told me and your examination,
All right.
um, I'd just like to speak a little bit about your concerns.
Mm-hmm.
Um, with respect to the X-ray,
Okay.
um, now it is something that is safe, right?
Mhm.
In pregnancy, the
I'm
dose of the
sorry. I'm sorry. I'm sorry. Did I hear correct that you said that X-ray is safe in pregnancy? why
Yeah.
that bit is in the Google that says that when you get an X-ray, I mean, you should inform the healthcare team that you're not pregnant. You're saying that X-rays, I mean, you're the first doctor who's saying that X-ray is safe in pregnancy. Is it?
Well, there are a lot of studies that are out there,
Okay.
and most of these studies have been performed on animals. And it did show a small number of the offspring will have childhood cancers, young cancers. Now,
I
this has
see.
not been the case in humans. All right?
Okay, so you reassure that
Yeah.
100% baby is fine. I mean, there's nothing related to an X-ray or the abnormality in the baby. This is what you're
Yes.
trying to say.
Yes. And the location of where the X-ray would have been performed is so far away from the womb
Oh,
to get,
doctor, can you write
yes.
it for me? Can you give me this reassurance that my baby is all fine and I'm all good to go with this pregnancy? I have so much of a panic attacks. I'll see that
Well,
daily and I'll get that
well,
reassurance, You're gonna save me.
we still need to do other investigations. For example, we need to ensure that the baby is inside the womb because you are having some bleeding.
Mm?
Have you had any ultrasound scans as yet?
No, no, I actually you're the first person I'm coming to.
Okay. So I just wanted to address with respect to your concerns about the X-ray to try to settle your
Sure,
mind on that.
sure.
Okay.
Yeah.
So coming to the bleeding now. This is, like I said before, something that is common in pregnancy. It happens
Mm-hmm.
to a lot of women, and the avenues could be different. Um, we need to perform an X-ray an ultrasound to ensure that the pregnancy is inside the womb
Okay.
and that baby has a heartbeat. So in cases where it is inside the womb and everything is going fine, and you are having this bleeding, light bleeding, and with no pain, we call this condition a threatened miscarriage. Do you understand everything I'm saying so far?
Threatened miscarriage. That means it's not a pregnancy loss. This means
It's not a pregnancy loss if it is within the womb and there is a heartbeat. Now, in all pregnancies, there's always the small chance of a pregnancy loss, but we will follow up on the pregnancy by doing another ultrasound later on.
okay. Charles, wind up the station 30 seconds more. Come on.
Okay,
Okay. So what do you
so
want me to do now, doctor? You don't want me to end up this pregnancy? You want me to continue this pregnancy, is it?
well, what you is up to you. It is safe. It can go forward if this is a pregnancy that you want. Then we can continue by repeating ultrasound in about 2 weeks' time. Ensure that baby is doing fine. Okay, I'll
I
discuss the case
see.
with your ultrasound. I'll discuss my case with my consultant, your case, and here's a patient information leaflet, and we'll see you back.
Successful in making you confused. Am I right? Yeah? Lots of
and and
fumbling, my sweet
and the
Charles.
time.
Yeah, I made sure that when I just confused you, you were like, oh, X-ray, oh, ultrasound, oh, consultant, oh. Thank you so much. All right, Charles. This was a tough station in exam. Thank you very much. A big round of applause, everyone, for Charles, because when I am in mood, it's very difficult to handle me as a role player. So, Ahmed, can we have a clap for Charles? Yes. Shama, now he would be saying, oh my God, why did I exchange today? Why did I accept this today? Yeah. Why didn't Shama was at my place? Yes. So next time, Charles will think twice before doing an exchange of a station. All right. Thank you very much, my dearest all. Okay. Thank you so much, guys. This is a repeated station in exam. The story was that the lady, this young girl, she was in her teens and she had an exposure to an X-ray and she had lots of questions. Moreover, she was taking antidepressants as well. Okay. So that shows her personality as well, that she's not very stable or not very strong in terms of a thought process. Charles did a beautiful job. He stayed very stable in the history taking. He stayed very, very calm in the history taking, talking to Findola. He was okay in addressing the concerns. I was I was trying to prompt so much, but he kept on nodding. He had a very good attentive listening thing. As an examiner, I could appreciate that he was taking my answer and asking the next question. This is a beautiful way of talking, a natural way of talking. The only thing where as an examiner, I would have the biggest concern is this part where I asked one question, and I don't know whether it was a slip of tongue or whether he just spoke it with confidence. That was that when I said that you are 100% sure that the baby is normal, and the answer I got was yes. I don't know, Charles, how could you be so sure that the baby is fine? I said, yes, I'm 100% sure that the baby
Right.
is okay.
And that this prompted me to go the route of doing the ultrasounds because we don't know what is happening as yet. Yeah.
Thank you very much.
Yeah.
Thank you very much. The moment we can never be 100% sure. It's not about X-ray, Ahmed. It's about the background risks of the abnormality in the pregnancy as well. Are you guys understanding what I'm trying to say? Yes? So how can we be so sure? And that's why I said, can you please write it for me? So I wanted you to come again to this that, see, I can't do that. But still you were on your point that no, the baby is fine. This one line can make patient safety straight away failing, my dear. Nothing in medicine is 100% surety. Why? Because it's not about that risk. It's about like probabilities. It's about that this may happen, this may not happen. But even if there's no risk, even if it would have been no X-ray, even then we have the abnormalities in the pregnancy, correct? Correct? Because there are some background risks overall. How much is this, Ahmed? Simran? How much is the overall risk, like background risk for the abnormality or the anomalies in the baby? Rupali? Come on, Rupali. How much is the overall risk?
1.8 to 2%.
2%, 2%.
So
3
overall,
to
for
4%.
pregnancies, they say 2% and up till 4% is the risk for background abnormality for any
Yes,
no
it's written in
patient.
epilepsy. Yeah.
Yes, of course,
Yes.
it depends upon age. It
Yes.
depends upon age. With age, definitely the anomalies, they are on a rise. In young age, it's not. But we can never be 100%. Now, what I wanted Charles to say is that we have the background risk. We cannot associate with an X-ray because generally the X-ray has got very less exposure. The chest X-ray has got very less harmful rays. Secondly, on the foot, it's far away from the tummy where the baby is. So these two elements does not let us come to a point that we want the termination of pregnancy. Having said that, bleeding itself needs to be investigated. We would do an ultrasound of the baby, and if the heartbeat is there, we call it as threatened miscarriage. Charles, I wanted you to speak to this when I said, oh, so that means it's a threat to miscarriage. You say yes. So it can be other reasons as well, like the pregnancy burrowing inside the womb. There is a chance that there is some local reason, but then we have to watch and see. We give you the bed rest. We can give you a sick note for your work. And we can avoid you for some general measures like avoiding sexual intercourse and avoiding the aggressive exercise. These are helpful measures for the patient. However, again, I would like to reassure that we do not have significant human studies showing the link between an X-ray and abnormality in the baby. The choice is yours. If still you want to end up the pregnancy, it's absolutely okay. We will give you all the evidence-based information, but the decision is yours. We'll support in your decision. Are you following me? Got it? Did you guys understand the way we are going to handle? When you're talking to the patient, friends, always remember, my idea always in exam is that when you're talking to the patient, sure, Ginu, my love, after that, I'll take you. Whenever you're talking to the patient, always think about examiner scorecard. When you'll start, this is the third step of your preparation. First step is learning the template. Second step is making a good flow. Third step is when you have a good flow, you're talking to the person in front, but you're thinking about the person on the side. Remember, this, if you reach to this point, you are at the best level of your preparation. And generally, students reach to this point somewhere 1 month or 20 days before exam, right? When you reach to this point, I'm saying this, but yes, I'm impressing examiner. I'm saying this, I'm impressing examiner. Here, you are in the best of your preparation. So, right, Charles, do you understand where I wanted you to? And I picked it up. I picked it up when you said that I'm 100% sure. So that was the point where we lost our patient safety. But you had been amazing. You were so cool and calm. The best thing is that you managed me for 10 minutes. That was the best thing. That was the best thing. If I would have been at your place, I would have been hands up. Ma'am is there. So, it's fine that, I know you since part 2. I know your efforts, and I'm really thankful that you managed it. So, sure, my dear Ramya, after Ginu, I would take you. Did you guys understand? Please, I'm here for the questions, if any. Any questions from this station? Any thoughts which you feel? Yes, Samantha, please. I'm happy to take the question.
Are we supposed to talk about like the animal studies and
So why we are talking about this, why Charles was talking about this, because this is what the talk article says. We've got that imaging talk article, guys. Did you guys see that?
Yeah.
Rania? Yeah.
Yes.
So there it's written that animal studies has got some blood cancers in the animals after the exposure. Unfortunately, we don't have any human studies for the extra exposure in pregnancy. All right. Okay.
and ma'am, should we talk about things like bed rest and everything?
Threatened
Towards
miscarriage, this is something which we do.
Okay.
Okay, we had a chat yesterday, guys. Can you please shed some light on that? A student asked, shall we give progesterone to her? Charles, what do you say? Ahmed, we can give her?
Since this is the first time,
If past history of miscarriage, you can
actually
give her
No,
until,
we are talking about Findola.
no, I would not offer
I
it.
think, no, just rest.
She says, can you give me some hormones to strengthen the pregnancy? Shama?
No.
No need.
Threatened miscarriage is not evidence-based. Threatened miscarriage is not evidence-based, but yes, if she has miscarriage and now she has a threat, yes. Okay, with a history, then yes, it becomes an indication as per UK recommendations.
But
Okay.
ma'am, the dosage, ma'am, for if in case now in this case she's a threatened miscarriage, so the dosage will be different, right, ma'am?
Yeah. So the pessary roses, we have different. We follow the nice guidelines for that, everyone. Okay, the miscarriage guidelines, but it is for the recurrent loss or at least one history. Okay, at least one history. Then we give the progesterone pessaries. All right.
And ma'am, what
In this case, we will give or not?
No, Ahmed, there are two things. You say that it's not evidence-based. However, there's one thing in exam you always remember, that is patient insisting. Even when she's not having an indication of CTG and she insists, we give her. So if you think that you feel that you will have some reassurance out of that, it doesn't have any harm, because Ahmed, there's no harm, right?
Yes, no harm, yes.
Right? So
Yeah.
if the patient insists, you, Charles, agree to her. And
Okay.
you're saying that it is not suggested. Generally, we do not give it, but if you feel that you'll start feeling better, or if it will give you some sort of a reassurance, we are happy to do that for you. I will discuss with my consultant. So always have that flexibility, because even when she's not having an indication of CTG, she is a candidate of intermittent auscultation, we have a point of like patient insisting. Keeping in view, my patient is anxiety, depression disorder, generalized anxiety disorder patient, Rupali, I'll be flexible with her. Okay. All right. Good girls, good boys. Very well done. I'm proud of you guys.